ABGs scare a lot of people because they're usually taught like a bunch of numbers you're supposed to memorize. But they make a lot more sense when you stop treating them like trivia and start treating them like physiology. In this video, I'm going to show you a simple way to name an ABG using a first name, middle name, and last name method. Once you can name it, you can start understanding what's happening in the body. And one of the biggest things I want you to remember is that a normal pH does not automatically mean a normal ABG. An ABG is not just a lab, it's a physiological snapshot. It tells you about acid base balance, ventilation, and oxygenation. The pH tells you whether the blood is too acidic or too alkaline. The normal range is 7.35 to 7.45. Your PaCO2 is your respiratory piece. Normal is 35 to 45. Bicarb or HCO3 is your metabolic piece. Normal is 22 to 26. And PaO2 tells you about oxygenation, with a normal range of about 80 to 100. At the simplest level, your pH reflects the relationship between bicarb and carbon dioxide. The lungs control the carbon dioxide and can compensate quickly, generally within a few minutes. The kidneys control the metabolic side, or the bicarb. Kidneys compensate more slowly, generally over hours to days. So let's go over the naming method. Even though we're calling it a first, middle, and last name technique, you actually solve it backwards so you can name it forward. So first, let's find the last name. Look at the pH. If the pH is less than 7.35, the last name is acidosis. If the pH is greater than 7.45, the last name is alkalosis. Second, find the middle name. Ask yourself which system matches that pH problem. Look at your PaCO2 and your bicarb individually and assess if the values are high or low. Then classify each individual value as acidosis or alkalosis. Whichever system matches your ABG's last name is your middle name. So, for example, if your last name is acidosis and your PaCO2 is high, that indicates acidosis. Since the respiratory system shares the same last name as your ABG, the middle name is respiratory. Third, we find the first name. For this video, we're keeping compensation very simple. If the pH is still outside the normal range, call it uncompensated. If the pH has returned to the normal range, but the other values are still abnormal, call it compensated. And again, this is the key point. A normal pH does not automatically equal a normal ABG. It may just mean that the body has compensated enough to normalize the pH. As a bonus, you can look at the PaO2. If it's less than 80, you can add with hypoxia to the end of your ABG name. So let's walk through a sample together. You have a pH of 7.38, a PaCO2 of 32, a PaO2 of 98, and a bicarb of 18. So let's start with the pH. 7.38 is normal, but it's on the lower end of normal. Remember, normal is 7.35 to 7.45. Anything less than 7.40 is acidosis, and anything greater than 7.40 is alkalosis. So for a pH of 7.38, the last name is acidosis. Now find the middle name. The PaCO2 is low. Normal is 35 to 45. The patient is blowing off their CO2 or their acid, pushing them towards alkalosis. A bicarb of 18 is low, with normal being 22 to 26. This indicates an acidosis. The bicarb may be low due to losing base or gaining acid, as seen in situations such as lactic acid buildup. Because the last name is acidosis and the metabolic pattern matches acidosis, the middle name is metabolic. Now find the first name. The pH is within the normal range, so we're calling it compensated. Then look at the PaO2. It's greater than 80, so there's no hypoxia. So the full name is compensated metabolic acidosis without hypoxia. Let's go through another one together. You have a pH of 7.48, a PaCO2 of 32, PaO2 of 102, and a bicarb of 23. So let's start with the pH. 7.48 is high. Remember, normal is 7.35 to 7.45. So with a pH of 7.48, the last name is alkalosis. Now find the middle name. The PaCO2 of 32 is low. normal being 35 to 45. The patient is blowing off their CO2 or their acid, pushing them towards alkalosis. A bicarb of 23 is normal, but on the lower end of normal. Remember, normal is 22 to 26. Any value less than 24.0 is acidotic, and any value greater than 24.0 is alkalotic. So a bicarb of 23 indicates acidosis. Because the last name is alkalosis and the respiratory pattern matches alkalosis, the middle name is respiratory. Now find the first name. The pH is outside the normal range of 7.35 to 7.45, so this is uncompensated. Then look at the PaO2. It's greater than 80, so there's no hypoxia. So the full name is uncompensated respiratory alkalosis without hypoxia. Awesome. Let's do one last one together. You have a pH of 7.28, a PaCO2 of 58, a PaO2 of 65, and a bicarb of 26. So start with the pH. 7.28 is low. Remember normal 7.35 to 7.45. So the last name is acidosis. Now find the middle name. The PaCO2 is high, greater than 45, and high CO2 means that the patient is retaining CO2, which pushes the patient towards acidosis. The bicarb is on the high side of normal. Remember, normal is 22 to 26. Despite it being normal, we still need to classify it as acidotic or alkalotic. Any value that is less than 24.0 is considered acidotic, and any value greater than 24.0 is alkalotic. So a higher bicarb of 26 would be considered alkalosis. Because the respiratory system matches the last name of acidosis, the middle name is respiratory. Now find the first name. The pH is still outside the normal range, so for today's framework, we're calling it uncompensated. Then look at the PaO2. It's below 80, so you can add with hypoxia to the end of the name. So the full name is uncompensated respiratory acidosis with hypoxia. Now, the important question is not just what to call it. The important question is, what does that pattern mean physiologically? Respiratory acidosis means the lungs are not clearing enough carbon dioxide. Carbon dioxide builds up, hydrogen ion concentration rises, and the pH falls. Major causes include decreased respiratory drive, like sedation or opioid overdose or sleep apnea. It can also occur from neuromuscular weakness, such as myasthenia gravis or Guillain-Barré disease. Or it can come from increased dead space or impaired ventilation, like COPD, asthma, or PE. Over time, the kidneys try and compensate by retaining bicarb, but that takes hours to days. So when you see respiratory acidosis, think the patient is retaining CO2 because ventilation is failing, depressed, or ineffective. Metabolic acidosis means the bicarb is low and the pH is low. This usually happens because the body is gaining acid or losing base. This can be caused by an increased acid production, such as lactic acidosis, diabetic ketoacidosis, or salicylate toxicity. It also may be caused by decreased acid excretion, like in chronic kidney disease or acute tubular necrosis. It can also occur with bicarb loss, such as with diarrhea or GI losses. The usual compensation is hyperventilation, which lowers the PaCO2. When you see metabolic acidosis, think the metabolic side has lost base or gained acid. Respiratory alkalosis means the pH is high and the PaCO2 is low. The patient is blowing off too much carbon dioxide. Respiratory alkalosis may be caused by pain, anxiety, hyperventilation, central nervous system stimulation, and some toxic causes like early salicylate effects or nicotine. Pulmonary problems can trigger hyperventilation. If it persists, the kidneys can compensate by excreting bicarb. So when you see respiratory alkalosis, think the patient is overventilating and washing out their CO2. Metabolic alkalosis means the pH is high and the bicarb is high. This usually happens because the body has lost acid or gained too much base. This may be caused by vomiting or NG suctioning, renal hydrogen loss from states like Cushing's, the use of loop or thiazide diuretics, or excessive bicarb administration. The expected compensation is hypoventilation, which raises PaCO2. So when you see metabolic alkalosis, think The metabolic side is too alkaline, often from acid loss or excess bicarb. One final caution: sometimes both systems are involved. A mixed disorder happens when both the respiratory and metabolic components are contributing. We're not doing a deep dive on that in this video, but I want you to know that the concept exists. And this brings us back to the biggest trap. A normal pH does not always mean a normal ABG. The pH may be normal because the body has compensated, not because the underlying problem is gone. That's why naming the ABG correctly matters. It helps you see the physiology hiding behind the number that might look less dramatic at first glance. So here's the takeaway. When you read an ABG, solve it backwards so you can name it forwards. Use the pH for the last name, use PaCO2 or bicarb for the middle name, and use compensation for the first name. Then ask the most important question: what is the body doing and why? If you want, in the next video, we can build on this and go deeper into compensation, mixed disorder, and more practice examples. And if this has helped made ABGs feel less intimidating, save it, share it with a nurse friend, and let me know in the comments which ABG pattern you want to practice next. And be sure to check out our website and app for more practice ABGs as well as an ABG interpretation tool.